Hello, my friend. Come in, sit down, take a moment, because today I want to talk to you about something very personal, something that happens to you every single day and has been happening for a while now. That moment when you go to stand up from your chair or get up from the sofa or rise from the toilet in the morning and your knees, they crack. Sometimes it is a soft pop. Sometimes it is loud enough that someone in the next room can hear it. And then comes the ache, that deep familiar ache just below the kneecap, or on the inside of the joint, or sometimes all around it. And you stand there for a second, waiting for it to ease, hoping it will ease, the way you always hope. And most of the time it does ease after a few steps, after the joint warms up. It gets a little better, but you know it will be there again tomorrow morning and the morning after that. My name is Dr. Thomas Reed. I am a physician in internal medicine, and I have been caring for patients for over 25 years, many of them wonderful people just like you, in their 70s and 80s, who have been living with this knee pain for so long that they have started to accept it, like accepting the weather, something you cannot change, something you just work around. And I understand why you feel that way, because nobody has ever sat down with you and explained what is actually happening inside that knee. And more importantly, what you can actually do about it. That is what I want to do today. I want to give you the real explanation, the honest medical picture. And then I want to give you a plan, a real plan, one that does not involve surgery, does not involve injections, does not involve a single prescription. Just science and time and a little consistency. So let us begin. Now, before anything else, I want to tell you what is not happening, because I think this will give you enormous relief. That cracking sound when you stand up, that pop, that snap, that grinding noise, in most cases, it is not your bones rubbing together. It is not cartilage tearing. It is not a sign that your joint is about to give out. The medical term for that cracking sound is crepitus. And crepitus in the knee has several causes, none of which should frighten you. The most common cause is gas bubbles. Inside your knee joint, there is a fluid called synovial fluid. This fluid acts like oil in an engine. It lubricates the joint, it reduces friction, it nourishes the cartilage, and dissolved within that fluid are tiny bubbles of gas. Carbon dioxide mainly. When you move the joint after a period of stillness, when you stand up after sitting, those bubbles collapse suddenly, and the collapse creates a popping sound. That is it. That is the crack. A bubble collapsing. Not bones, not damage, a bubble. The second cause of knee cracking is tendons and ligaments around your knee. There are tendons and ligaments, bands of tissue that help hold the joint together and guide its movement. When these bands move over the bony prominences around the knee joint, sometimes they snap, like a rubber band flicking over a doorknob, and that creates a clicking or snapping sound. Again, not damage, just movement. And the third cause, the one that is most relevant for people over 70, is changes in the joint surface. As we age, the cartilage inside the knee, that smooth rubbery cushion that lines the ends of the bones, begins to change. It becomes thinner in places. The surface becomes slightly less smooth. And when two slightly rougher surfaces move against each other, even with synovial fluid in between, you can hear and feel that grinding sensation. This is where the ache comes from. This is what we need to address. And this is the part that is actually changeable. That is what I want you to hear. This is changeable. Now let me explain cartilage to you properly, because cartilage is fascinating, and understanding it is going to change the way you think about your knees. Cartilage is a living tissue, but it is unusual compared to other living tissues in your body. It has no blood supply of its own. Think about that. Your cartilage cannot be directly fed by blood vessels. Because if blood vessels ran through your cartilage, every time your knee bent, those vessels would be crushed and they would bleed. So cartilage evolved a different system. It feeds itself through the synovial fluid, that fluid I mentioned earlier. Like a sponge, when you move your knee, the cartilage compresses slightly and then expands. And in that expansion, it draws fresh synovial fluid in, like squeezing and releasing a sponge in water. This is how cartilage gets its nutrients. This is how it stays healthy. And this is the first clue about why things go wrong after 70. Because here is what else changes in that synovial fluid after 70. The concentration of something called hyaluronic acid drops significantly. Hyaluronic acid is the molecule that gives synovial fluid its thick, gel-like, lubricating quality. In a young person, the synovial fluid is thick and viscous, like a rich oil. It cushions beautifully. But after 70, the cells that produce hyaluronic acid slow down. The fluid becomes thinner, more watery, less protective. And so the cartilage surfaces, even if they are not severely worn, are moving against each other with less protection than they had before. And that is part of the ache and part of the solution. Because we can address this without a single needle, without a single drug, through what you put in your body every single day. Now let me tell you about collagen, because this is the heart of the plan I am going to give you today. And I want you to understand it deeply, not just to follow instructions, but because you deserve to understand your own body. Cartilage is made primarily of collagen, type 2 collagen specifically, a mesh of collagen fibers woven together like a net that gives cartilage its strength, its flexibility, its ability to absorb shock. In a young body, this collagen mesh is thick and dense, constantly being repaired and renewed. But here is what happens after 60. Two things happen simultaneously. The rate of collagen production in the body slows down significantly, and the rate of collagen breakdown stays the same, or even increases. So you are losing collagen faster than you are making it, in the skin, in the bones, in the tendons, and in the cartilage. Now, for years, the medical community believed that taking collagen by mouth was pointless. The thinking was, when you eat collagen, the digestive system just breaks it down into amino acids, and those amino acids go wherever the body decides to send them. Not necessarily to the knees, but research over the last 15 years has shown something genuinely remarkable. When you take a specific form of collagen called collagen peptides, also called hydrolyzed collagen, the digestion of these peptides produces specific fragments, small collagen building blocks called dipeptides and tripeptides. And these specific fragments are absorbed into the bloodstream intact. They are not broken all the way down to basic amino acids. They survive digestion as partial chains. And here's the extraordinary part. These collagen fragments, once in the bloodstream, appear to signal the cells in your cartilage, the cells called chondrocytes, to begin producing more collagen. They act like a signal, a message to the joint that says, we need more building material here. Start building. Multiple randomized controlled trials published in respected journals have shown that daily collagen peptide supplementation reduces knee pain in people with osteoarthritis, improves joint function, and in some studies shows measurable improvement in cartilage thickness on imaging. Let me say that again. Measurable improvement in cartilage thickness from a supplement you take every morning in a glass of water. No surgery, no injection, no prescription. Just collagen peptides, taken consistently every day. Now, here's the important detail about how to take it, because the dose and the timing and what you take it with all matter. The dose that has been used in the strongest clinical studies is 10 grams per day. Not 5, not 2.5, 10 grams. That is the threshold dose where consistent results have been shown. Many collagen products on the market contain only 5 grams per serving. Make sure you are taking 10. You can take 2 scoops of a 5-gram product, or find one that gives you 10 grams in a single serving. The timing: morning is best, on an empty stomach or with a light breakfast. This is when the signaling effect appears to be strongest. Now, here's the part that most people miss, and it is absolutely critical. Collagen production requires vitamin C. Not just a little vitamin C, adequate vitamin C. Vitamin C is a cofactor in the enzyme that converts procollagen to collagen. Without enough vitamin C, your body cannot assemble the collagen even if it has all the raw materials. It is like having all the bricks, but no mortar. If you take collagen without vitamin C, you are getting a fraction of the benefit. Take 500 to 1,000 milligrams of vitamin C at the same time as your collagen every single day. That combination, collagen peptides, 10 grams, plus vitamin C, 500 to 1,000 milligrams every morning, consistently for 6 to 8 weeks, is what the research supports and what I have seen make a real difference in my patients. Now I want to tell you about something that works alongside collagen. Something that addresses the other half of the problem, the synovial fluid. Remember the hyaluronic acid, the molecule that makes your joint fluid thick and protective. That declines significantly after 70. Well, there are natural ways to support hyaluronic acid production in the body. The first is something you may have heard of, but probably not in this context. It is bone broth. Genuine slow-cooked bone broth. Not the powder, not the bouillon cube, real bone broth made from simmering bones for 12 to 24 hours. Contains natural hyaluronic acid precursors, compounds called glucuronic acid and acetylglucosamine, that your body uses to build hyaluronic acid. 1 to 2 cups of bone broth per day provides these precursors directly. And multiple studies show measurable improvement in joint lubrication and pain reduction from regular bone broth consumption in older adults. The second natural support for synovial fluid is found in something much simpler: water. Synovial fluid is approximately 80% water. When you are dehydrated, even mildly dehydrated, the fluid in your joints thins. It becomes less effective. Many seniors are chronically mildly dehydrated, not dangerously dehydrated, but just short of optimal. And that chronic mild dehydration is contributing to the poor quality of their joint fluid and the ache they feel every morning. 6 to 8 glasses of water per day, sipped throughout the day, not gulped all at once, is one of the simplest joint care habits that exist, and most seniors are not doing it. Now, let me tell you about something that reduces the pain component directly, while the collagen is doing its long-term rebuilding work. Because 6 to 8 weeks is the timeline for structural improvement, but you need help in the meantime, and I want to give you that help. The first natural pain reducer is turmeric with black pepper. Curcumin, the active compound in turmeric, is one of the most well-studied natural anti-inflammatory compounds that exist. Multiple clinical trials have compared curcumin to ibuprofen for knee osteoarthritis pain and found comparable results without the gastrointestinal damage, without the kidney risk, without the cardiovascular concerns that come with regular NSAID use in seniors. The dose used in most studies is 500 milligrams of curcumin extract twice daily. And here is the critical detail. Curcumin alone is poorly absorbed. You need black pepper. Specifically, a compound in black pepper called piperine. Piperine increases curcumin absorption by up to 2,000%. 2,000%. So always take your turmeric or curcumin supplement with black pepper, or look for a product that already contains piperine. The second natural pain reducer is omega-3 fatty acids, fish oil, or flaxseed oil if you do not eat fish. Omega-3 fatty acids reduce the production of inflammatory compounds in the body, called prostaglandins and leukotrienes. These are the molecules that create swelling and pain in arthritic joints. Omega-3 reduces them consistently with very few side effects. The dose that shows meaningful anti-inflammatory effects is 2 to 3 grams of combined EPA and DHA per day. That is the combined amount of those two specific fatty acids, not just total fish oil. Read the label, add up the EPA and DHA numbers, and make sure together they reach 2 to 3 grams. The third natural pain aid is something many of my patients have been surprised by. It is heat. Simple, free, and remarkably effective. A warm compress or a warm water soak applied to the knee for 15 to 20 minutes in the morning before you get up and start walking does several things simultaneously. It dilates the blood vessels around the joint, increasing circulation to the area. It warms the synovial fluid, making it more viscous and protective. It relaxes the tendons and ligaments around the joint, reducing the snap and pull that contributes to cracking. And it signals the nervous system to reduce pain perception in that area. A simple warm compress every morning before you stand can reduce your morning knee pain by a significant amount within the very first day, not weeks, days, or the very first morning you try it. Now I want to talk about movement, because I know that when your knees hurt, the last thing you want to do is move them. And I understand that completely. But I need to tell you something important about this, because it changes everything. Remember what I told you about how cartilage feeds itself to the sponge mechanism through movement, compression, and decompression, drawing synovial fluid in and pushing it out? If you stop moving because of pain, the cartilage receives even less nourishment. It degrades faster. The synovial fluid becomes more stagnant, and the pain actually gets worse over time, not better. Rest does not heal cartilage. Movement does. But, and this is important, the right kind of movement. Not high impact, not running, not jumping, not anything that pounds the joint. Gentle, controlled, low impact movement that moves the joint through its range without loading it heavily. The single best exercise for knee cartilage health in seniors is cycling. A stationary bike is ideal. Low resistance, comfortable seat height, just pedaling, even 10 to 15 minutes every single day. The repetitive low impact motion of cycling pumps synovial fluid through the cartilage beautifully, strengthens the quadricep muscles that support the knee, and does all of this without pounding the joint. If you do not have a stationary bike, swimming is equally good, or water walking. The buoyancy of water removes most of the body weight from the joints and allows fluid movement without stress. The second exercise I want you to do is straight leg raises. Lying flat on your back, one leg straight, other knee bent, lift the straight leg to about 45 degrees. Hold for 3 seconds, lower slowly. 10 repetitions each leg twice a day. This exercise strengthens the quadriceps, the large muscle group at the front of the thigh. That is the primary muscle responsible for supporting and protecting the knee joint. When the quadriceps is strong, it absorbs shock before it reaches the knee. It stabilizes the joint during movement, and it reduces the load on the cartilage significantly. Studies have shown that seniors who strengthen their quadriceps experience up to 50% reduction in knee pain without any other intervention. 50% from one muscle group made stronger. The third exercise is heel slides. Lying on your back, slowly slide one heel up toward your buttocks, bending the knee as far as is comfortable. Hold for 3 seconds, slowly slide back down. 10 repetitions each leg. This moves the joint through its full range of motion, pumps the synovial fluid, maintains flexibility, and prevents the joint from stiffening. Do these 3 exercises every single day. They take less than 10 minutes, and they are the foundation of real long-term knee improvement. Now, let me talk about something very practical that can change your quality of life starting today, not weeks from now, today. The way you stand up from a chair matters enormously. Most people with knee pain stand up in a way that puts maximum stress on the joint. They lean back, try to push themselves up from a deep bend, with the knee bearing all the weight. I want to teach you a different way. When you are ready to stand up from a chair, first slide forward to the edge of the seat. Then lean your whole torso forward, nose over toes, so your weight shifts onto your feet. Then push up through your heels, using your leg muscles to lift, rather than your knee joint to push. This simple technique, slide forward, lean forward, push through the heels, reduces the force on your knee joint when standing by up to 40%. Practice it. Every time you stand up, it will feel awkward at first, but within a week, it becomes automatic, and your knees will thank you. Now, let me also talk about shoes, because this is something seniors rarely hear about, and it matters more than most people realize. The footwear you walk in every single day directly affects the load on your knee joint. Shoes with no cushioning, flat, hard soles, like many dress shoes or loafers, send every footfall impact directly up through the ankle, into the knee, into the hip. Cushioned shoes, proper walking or running shoes, with shock-absorbing soles, absorb a significant portion of that impact before it reaches the knee. If you are wearing flat, unsupportive shoes and your knees ache, a pair of well-cushioned walking shoes is not a luxury. It is medicine, and it is cheaper than a single doctor's visit. There is also something called a knee sleeve, not a rigid brace, a soft compression sleeve that fits over the knee. These are available at any pharmacy, and they do something remarkable. They provide light compression, which reduces inflammatory fluid buildup around the joint. They provide warmth, which improves synovial fluid quality, and they improve something called proprioception, the knee's awareness of its own position in space, which actually reduces pain signals from the joint. Studies have shown that wearing a soft knee sleeve reduces perceived knee pain by a significant margin in seniors with osteoarthritis, not because it is doing anything structural, but because of the warmth, the compression, and the proprioceptive feedback it provides. A knee sleeve, worn during activities, is one of the simplest and most underused tools for senior knee pain. Now, I want to give you the complete picture, the full plan, in order, so you know exactly what to do, starting tomorrow. Step 1, every morning, before you stand up, apply warmth to your knees. A warm water bottle wrapped in a cloth or a warm, damp towel for 15 minutes while you're still in bed or sitting up. This alone will reduce your morning stiffness and pain significantly. Step 2, every morning, take your collagen peptides, 10 grams, in a glass of water or juice with 500 to 1,000 milligrams of vitamin C. At the same time, every single morning, no skipping. Results take 6 to 8 weeks of consistent daily use. Step 3, add turmeric curcumin extract, 500 milligrams, twice daily, with black pepper or piperine. This reduces joint inflammation while the collagen does its longer-term work. Step 4, add omega-3 fatty acids, fish oil, or flaxseed oil, 2 to 3 grams of combined EPA and DHA per day with a meal. Step 5, drink your water, 6 to 8 glasses spread throughout the day. Your joint fluid depends on it. Step 6, do the 3 exercises every single day. Straight leg raises, heel slides, and if possible, 10 to 15 minutes of gentle cycling or walking in water. These exercises rebuild the muscles that protect your knee, and they nourish your cartilage through movement. Step 7, practice the stand-up technique. Slide forward, lean forward, push through the heels every single time. Step 8, get proper footwear, cushioned, supportive, and consider a soft knee sleeve during activities. Step 9, if you enjoy soups, start making or buying genuine bone broth. 1 to 2 cups per day supports synovial fluid quality naturally. Step 10, give it time. I know that is hard to hear. I know you want relief today, and the warmth in the turmeric will give you meaningful relief today. But the deeper improvement, the cartilage rebuilding, the real structural change takes 6 to 8 weeks. Some patients see improvement at 4 weeks, some need 10 or 12, but the research is clear. It happens, and it is real. Now I want to tell you when knee pain needs a doctor, because not every knee situation can be managed with what I have described today. If your knee is swollen, warm to the touch, and the swelling came on quickly, please see your doctor. This could indicate infection or significant inflammation inside the joint. If you have fallen and your knee is painful in a new way, please get it examined to rule out fracture. If the pain wakes you from sleep, not discomfort from a bad position, but genuine pain that wakes you, that warrants evaluation. And if you have been managing knee pain for years, and it is now significantly worse than it was 6 months ago, that change in trajectory should be assessed by your physician. For most seniors watching this, the program I have described today is safe, appropriate, and genuinely effective. But you know your body, and if something feels different enough to worry you, please go to your doctor. You are allowed to do both, use natural tools, and see your doctor. They are not mutually exclusive. Let me close with something I feel deeply. Your knees have carried you for 70 years, or 75, or 80. They have carried you up staircases, and through gardens, and to bedsides when someone you loved was sick, and across dance floors, and through the front door when you came home from things that were hard. They have never once asked you to slow down. They have just carried, and carried, and carried. And now they are asking for something in return. A little attention, a little support, a little care, not surgery, not suffering through it, just collagen and vitamin C, water and warmth, gentle movement and good shoes. These are not big asks. These are small acts of kindness to a part of your body that has served you faithfully for an entire lifetime. I believe you can do this. I've seen patients at 78 go from struggling to stand to walking their grandchildren around the park with consistent effort and the right support. That is possible for you. I genuinely believe that. I am Dr. Thomas Reed. Thank you from the bottom of my heart for spending this time with me today. If this gave you hope or a plan or simply the feeling that someone understands what you are going through, please share this video with a friend, a spouse, a neighbor, anyone who winces every time they stand up. They deserve to hear this. Leave your questions in the comments. I read every single one, and I will do my best to answer. Take care of those knees. They have earned it, and I will see you in the next video.